We're live.
Good morning, Facebook family. Always
We're
good
live,
to
Pop.
see y'all on a Monday morning. And again, it's Pop Barnes Health and Community Tip for the week. And I have with me our regular group, the two organizations that do so much in the community to help the citizens of Columbus, Georgia. And that's New Horizons Community Health with the Chief Executive Officer, Miss Andrea Winston, and the Tree of Life Healthcare with the Reverend Dr. Laurel Clyott. And I have special guests today. Well, I'm trying to turn my phone off. There we go. I have special guests today. I have Dr. Nikita Pitts, a friend of mine, and who's done an awesome, with a capital AWESOME, job on the PowerPoint presentation on cardiovascular, and Miss Brandy Clyott. And so I'm going to ask next person, Dr. Clyott. I didn't mean to skip. Would you say something to our viewing audience as always?
Good morning, Facebook friends. It's a great day to be with you, and we are grateful again for this show that Councilman Barnes put on for us every week. Hopefully and prayerfully you've learned a lot, and we're thankful again. Have an excellent presentation for you this morning on cardiovascular with Dr. Pitts and Brandy Clyott. We're doing our slideshow, and welcome. God bless you.
And as always, Miss Susan Gallagher. Susan, got to have the show with Susan on it.
Good morning, Facebook family. Susan Gallagher with New Horizons Behavioral Health. And today's topic is so important because cardiovascular disease is the #1 killer of Americans. So I urge you to please pay attention to what Dr. Pitts is going to be presenting this morning. It's very important information.
And Dr. Pitts, would you tell our viewing audience a little bit about yourself?
Well, good morning, everyone. As Mr. Barnes stated, I am here. I work as a volunteer with Tree of Life, but more recently, just on leave from right now, from Phoenix City Joint Rehab Center, where I serve as the medical coordinator there. I studied medicine and in Europe, and following my education there, I came back to the U.S. Actually put my residency on hold to care for my parents. And so while studying for board exams and caring for my parents, that's actually currently what I'm doing now. And in that time, also trying to get some time to volunteer. So currently, that is what I'm doing now.
Awesome, awesome. You touch my heart every time you say that because you only get one set of parents. I think we're going to have Randall because Dr. Pitts is somewhat frozen right now. So is there any way Susan, we can contact Randall so we can get Randall back in here to do that technological magic that he always does? Thank you. And to our Facebook viewing audience, just, life would be dull if Murphy's Law did not step in every now and again to keep you on your toes. And so Dr. Pitts is our guest lecturer today, and so we have to have everything right with her. But to talk about Dr. Pitts, I've called on Dr. Pitts on a number of occasions, and the delay here gives me just a little bit of time to talk about the two organizations that are partnered with me, and that's the Tree of Life Healthcare and New Horizons Behavioral Health. And I always start with New Horizons because I was what was my title? Let me see. I was the charge nurse of outpatient clinic at New Horizons. And let me tell you something. It created a bond with me because there we go. I see Dr. Pitts moving now, so I know somebody's done something. Because I was a nurse here, I really found out what a charitable organization is really like. Because here at New Horizons, they don't turn away anyone. And I always make a joke that after I was here for about a couple of months, I went home to my wife and I said, you want to know something? I like this organization. This organization cares about people. But I noticed up on the wall, they had a list where they were asking their employees to give money so that they continue taking care of patients. I don't know whether I'm going to have a salary baby next week. All joking aside, that warmed my heart for New Horizons. And I've known Pastor Clyde and how charitable he is. And the fact that he has started this organization. What happened is that he turned a tragedy into a blessing for the community. And I've had him tell that story before, and probably at the end of the show we'll do that. But I don't want to take up too much of Dr. Pitt's time, or I know who did leave out. Ms. Clyde, would you say something, Brandy, about yourself to our Facebook viewing audience?
Hi, everyone. My name is Brandy Clyde, and Pastor Clyde is my dad. And with Tree of Life, I help there volunteering, mainly doing administrative tasks. And I will be running the PowerPoint slide this morning.
And thank you, Brandy, for that. Okay, Dr. Pitts, the ball is in your court. I went through your slides a couple of times, and even some of the stuff that I knew you enlightened me on. So put some more of that education on me this morning. I appreciate it.
Okay, well, again, thank you for the opportunity. Cardiovascular disease, it covers a large, well, think of it as a large umbrella of diseases, and we're just going to focus mainly on the coronary artery disease.
Dr. Pitts, we can just barely hear you. We can just barely hear you. I don't know what but we can just barely hear you.
Is this?
Probably turn your volume up.
I'm sorry. Is this better?
Can you turn your volume up?
Yeah, sorry, it's up as much as it can go. Maybe if I speak into it. Is that better?
That is better.
Okay. Okay.
Yeah,
so
that's better. I can hear say.
It's better. Okay. So when we talk about cardiovascular disease, any problems or impairments with the heart itself, any impairments, think of it as like the 4 components of the heart. So, there's an impairment in either the blood flow, the conductivity, or the contraction and pumping action of the heart muscle itself, or with the heart valves. All right. So again, with the long list of different cardiovascular diseases, it usually will fall into one of those 4 areas. Okay, whether there's a problem with the blood flow, a problem with the conductivity or the pumping of the heart, the muscle itself, there are like any infarcts or dead tissue, and with the heart valves. Okay, whether there's blockage with the heart valves. And so moving on to our next slide, we think about the number of people that are affected by heart disease, and the death rate attributable to cardiovascular disease is around 219 per 100,000 people. We're talking about in the United States. So on average, someone will die from cardiovascular disease every 37 seconds in the US. And, that's about 2,500 deaths per day. Okay, and so cardiovascular disease, just thinking of the many types, again, we're focusing on CAD, or coronary artery disease, heart attack, arrhythmias, heart failure, congenital heart defects, cardiomyopathy, peripheral arterial disease. Many of these, and there are so many more, these are just a listing, but again, there are so many more, and things related to heart disease, like an abnormal heart rhythm, angina, pain in your chest, atrial fibrillation, again, dealing with how the electrical activity of your heart, how it processes. So with coronary disease, we are focusing on the buildup in the walls of the arteries, of the coronary arteries, which are the main arteries to supply the heart. Plaque is made up of cholesterol deposits, right? And so when the plaque builds up, it causes the inside of the arteries to narrow over time. And this process is called atherosclerosis, okay?
Right.
Sometimes you might hear the term arteriosclerosis. The terms are sometimes used interchangeably, But atherosclerosis is like a type of arteriosclerosis, and
Right.
arteriosclerosis is like the hardening or the thickening of the arteries over time, and it's mainly attributed to old age. So again, the leading cause of death in the U.S. again is due to coronary artery disease. It's the #1 killer in both men and women, and it is the most common type of heart disease. All right, and just some facts about the different or the disparities between blacks and whites. In 2017, a study was conducted where African Americans are like 20% more likely to die from heart disease than non-Hispanic whites. So, you know, there are lots of correlations to be made from that, depending on, or rather related to the societal norms of what could be causing that. Also, the deaths
And
from
Dr.
vascular disease
Pitts?
itself account. Yes.
Yeah, this leads into something. There are so many sociological factors that interplay with that, socioeconomic factors that interplay into that. And I was at a conference 2 years ago where really that was highlighted for many ethnicities that live in areas where they don't have access for the right kinds of foods or for nutrition. And fortunately, here in Columbus, Georgia, the mayor, Skip Henderson, has commissioned a study group. And what we have recently done is to identify where all the what they call food deserts are. And so things of that nature where people can have to only go to various mom and pop stores and not get nutritionally adequate foods. But I just wanted to highlight to our audience that also interplay with that or the societal parameters where people live at, their conditions that interplay with that. And that now people are focusing more on that, emphasizing that to be able to control the high rates among some ethnicities. And I didn't mean to interrupt you.
Right.
If anybody wants to jump in, the way we do things on the program is just mention a person's name to get their attention and then make your comments. So everybody feel free to do so. Thank you, Dr. Pitts.
Okay, right. Oh, you're welcome. But at the end of the presentation, there is a study, and I have it listed in the references, where you can look at the racial disparities regarding many diseases, but again, focused on heart disease. It's a really good read for the future. So getting back to coronary artery disease, it affects about 40,000 there are about 40,000 deaths per year worldwide, specifically related to coronary artery disease. Some risk factors, and we'll talk more about them later, are hypertension, diabetes, having a diet of high in cholesterol, obesity, stress, and smoking. On the next slide, we have a visual image of the coronary artery itself and what's actually happening with the buildup of plaque. I don't know if you can see it yet, but again, we look at the coronary artery itself, okay, and within this artery, plaque is starting to build up. You see along the edges, along the sides of the artery, the lighter yellow color. And so as plaque builds up, again, most likely due to cholesterol, it's going to prevent the blood flow.
Right.
And you know, the coronary artery is the main artery to supply the heart. If blood is not circulated properly to the heart muscle itself, it leads to the muscle dying. Okay, so you have dead tissue. That dead tissue will cause the heart to not contract properly as it should.
Right.
Okay, and so as we go to the next slide, again, talking about the process of atherosclerosis, looking at the two words, athero is soft or porridge-like. Atheromas are fatty deposits in the artery wall. Then you have sclerosis, the left part of the word, which is hardening or stiffening in the artery itself. It affects mostly medium and large arteries, and it's usually caused by, you know, chronic inflammation within the artery itself, which then activates the immune system. And on the next slide, again, it causes deposits of lipids or fats within the inside, within the lumen, or we say, of the vessel itself. Those plaques then stiffen and harden up, and it can lead to three main processes. Number one, hypertension. So with hypertension, this creates strain on the heart itself to pump blood through the artery wall. All right. Also stenosis, which is the narrowing itself of the vessel. That narrowing is going to cause decreased blood flow to other parts of your body. It can cause PVD, which we call peripheral vascular disease. So vessels in the lower parts of your body, let's say your legs, for example, will not get the proper supply, and it can cause pain as well. And then the third thing is there's a plaque rupture. So on that slide and on future slides, you'll see when that plaque builds up, and if it breaks off, it'll cause a thrombus, okay? And this, let's say, ball of thrombus or the cholesterol deposit, it's gonna block the blood flow, okay? And when that blood flow is blocked, it leads to, again, ischemia, which is narrowing, and heart attack event, because the area of the heart is not receiving the proper blood supply that it should. On the next slide, you'll see—
Dr. Pitts, can I ask a question?
Sure.
In relation with what Councilman Barnes was saying earlier about food deserts and not getting properly nutrition, what effect did that have as far as diet and not getting the proper nutrition as far as contributing factors to cardiovascular disease?
Okay, yeah. Well, everything related to your lifestyle, not having enough food, and even if you have enough food, it's the type of food. So you can have a pantry full of, that's stocked full, but what is it stocked full of? If their food's high in, let's say, saturated fats, high in salt content, those make a big difference. And so it's not just about not having enough food and then you get enough food, but what kinds of foods are you stocking? And that's really important.
Exactly.
And so earlier in the earlier slide, when we talk about your diet or having a better diet, a proper diet, it's important to include fresh fruits and vegetables, a diet that's not high in fats. And if you're in a community where that's all you're offered, then that's what you're going to buy. It affects many people in various communities, and so that's why education is so important. But to your question about how what effect it has on it, it affects it greatly. Because if that's all you're able to provide, then that's what you're going to eat, and you're going to continue eating it. And it's not only for yourself, but you're feeding this to your families, and especially starting at a young age, the children, that's all they know, that's all they're going to eat. So it's a cycle that's repeated.
Hey, Dr. Pitts, you are 150% correct. The committee that Mayor Henderson has gotten, he's put Dr. Stephen Leichter, endocrinologist, to run the program, and we're broken up into two committees. The one committee was to find out where the food deserts were, and to also, at the same time, locate what mom and pop businesses are in that locale. The second committee that I'm on is to get the word out, but also, to your point, Dr. Clyde, and to your point also, Dr. Pitts, if the people have to live in that particular locale, what do you do? So what you do is that you have nutritionists, dietitians, educate the individuals on how to prepare the types of food. For instance, if the only vegetables that they can get canned vegetables, then you thoroughly wash those canned vegetables prior to preparation. And it's also teaching the people how to prepare I'm going to tell you something now. I'm a nurse. Everybody knows I'm a nurse. But trust me, there's something about fat that gives that food just that extra twang. Well, I've learned as a nurse that there are other things that you can do to get that same twang, that same robust, ooh la la type of thing out of your food, besides the things that hurt you. And so the commission that the mayor has is awesome. It's going to really impact this region, because we did a study, city commissioned a study, and it showed a belt. The highest prevalence of heart disease, the highest prevalence of diabetes, the highest prevalence of hypertension, and this area was off the chain. And so there's going to be a lot of education. Even Dr. Leiter is even going to talk about the various cannabinoid, let me think now, the hormones that really make you hungry or want you to eat more. I'm trying to think of the technical terms now, it eludes me now, but they're the cannabinoids that trigger hunger, but there are also hormones that you have that tone it down. And so it's even going to be teaching those types of things that Dr. Leiter is going to do. And so this is really, this subject here, cardiovascular health, is extremely, extremely important. So great that you've taken the time to give your presentation. Don't mean to interrupt you, but this is good discussion for not only for us to have, but for our viewing audience as well. Like if you can go on with the slides.
Right. Okay, sure. And so some of the next slides, if you can see where we show ischemia, again, where that can lead to an infarct, where there's dead tissue or muscle. Right here, you see on the image, the heart muscle, cross-section of it. The darkened area there is the infarct itself. And what's happened is ischemia has caused this infarct, the narrowing of that vessel where there's less blood flow to it. And again, no blood flow, then it can't live. It's not going to survive. So it leads to dead tissue there within the heart muscle. And that area will affect the contraction of the heart. And so again, you know, we had a listing of other cardiovascular diseases. There's a specific type of this heart disease where the contraction of the heart is where it's mainly affected. And so that's just one of the reasons why it's so important to not have arteries blocked or narrowed. PAD, peripheral arterial disease, this is also something that can manifest or a type of heart disease. As we said earlier, the coronary artery, when it's blocked, blood flow cannot get to the heart, but that also means blood going to other parts of your body, especially the lower extremities, it's affected. And so there's no blood flow going to the lower parts of your legs. And as you see, plaque can build up. You might not be able to see it as well.
Exactly.
Plaque will build up in those arteries as well in your lower legs. The same thing that's happening with your heart muscle, it's also happening within the lower vessels. So it can cause pain and really a serious condition, because no blood flow. We're dealing again with, it can cause dead tissue and dead muscle. And some people might even develop gangrene to where a lower limb might have to be amputated due to not having proper blood supply. On the next slide, it just shows the normal flow of the artery versus an artery that's filled with plaque. And as you see the image on the right, you see plaque build up along the walls of that vessel, again, showing the narrowing of the blood flow. Okay, and on the next slide, just to tell you about some general warning signs and symptoms a person might have. You could feel extreme fatigue, constant dizziness or lightheadedness. You could have a fast heart rate or new or irregular heartbeat, chest pain, discomfort that may go away when you rest, and also difficulty breathing. You're doing regular exercise activities, a respiratory infection or cough that can become worse, restlessness, confusion, changes in your sleep patterns, and a loss of appetite. The most common symptom of coronary artery disease is angina, which is just a chest pain. It can be a heaviness or tightness or stiffness of the chest. It feels like, you know, there's pressure on your chest. You can feel numbness and like a squeezing feeling within your chest. And what most people sometimes describe it as maybe feeling like indigestion or heartburn.
Right.
So we get to the next slide, talk about risk factors. And risk factors, there are many of them, and just kind of categorize them in non-modifiable and modifiable risk factors. Non-modifiable are things that we cannot change. Older age is a risk factor, having a strong family history, and being male. Even though, yes, men, it is the #1 killer of both, but males tend to have a prevalence of risk is a risk factor for the disease. Modifiable ones are considered things that we can change: alcohol use, smoking, having a poor diet, as we mentioned earlier, diet high in sugars or fats, being obese, having a sedentary lifestyle, having poor sleep hygiene, and stress. And these are things that we can
Dr. Pitts,
change. Yes.
Dr. Pitts, I'd like for our viewing audience, while you have that slide up, risk factors, can we pull that slide back up again?
Okay.
This is the good news, folks. This is the really good news when I look at this here. When I look on the left side, I said, well, guess what? Nothing could change my age. Guess what? Nothing could change the genetics, what my genes are going to forecast for me, or being male. But if you look at the list, this is the good news. This is the capital G, the capital O, the capital O, the capital D news. That list on the right is way longer than that list on the left. So this means that we can control these things. And in the classes, the health classes that I love to give, I try to tell people we are in control of our own health history. And so if you look on the other side, you look alcohol use. Does it say not to drink alcohol? No, but it tells you to use discretion. Because I read in some material that even red wine could be good for the heart. Smoking, everyone knows smoking is verboten. It's not good for you. Poor diet, what we're stressing in this study that the mayor has commissioned. Obesity, if you follow a really good diet, you don't have to worry about the obesity. Sedentary lifestyle, listen. I read somewhere how many minutes are in a day or something. They say, can't you take 30 minutes out of your day, 5 days a week, to exercise? And you want to know something? Someone like me, who prays to the good Lord, please give me length of days so I can try to do as much good as I can on this earth. I get up every morning, 30 minutes, get on my treadmill for 15 minutes. I get on my total gym and I feel like I'm Chuck Norris. I get up there and moving back and forth and exercise those muscles. I get my 30 minutes. And that's something that everybody can do. Look, I think I mentioned this before. I am not getting any kickbacks from Chuck Norris. I have my 3rd total gym. And trust me when I tell you, it is a good machine to work. Lord, I'm not getting any kickback, but for someone, particularly senior citizens, you don't traumatize your joints like you do with free weights. I get on that bad boy and I do the loosening up exercises, the strength, so I don't hurt my joints. Then I raise it up a little bit more so I can, because you've got to exercise those muscles as a senior, and I do that. And while I'm exercising, those endorphins kick in. I forget that I'm 77, I feel like I'm 37. So exercise has been proven also, and Dr. Pitts, you can correct me. I think everybody's laughing, but my wife knows it's true. I get out of that total gym. I think that they did a study, and you can correct me if I'm wrong, that when you exercise, the exercise helps to produce the good cholesterol, the HDL in your system, that helps to lower the LDL, the low density lipoproteins that contribute to inflammation. So besides, getting there and toning up muscles, exercise is very, very, very important for your cardiovascular system. And so I like to stress the fact that on the right-hand side, we have things that we can control to make sure that we are heart healthy. And so, Dr. Pitts, I didn't mean to interrupt you, but I wanted to let people know that exercise is good. They need to do it 5 days a week, I think, for 30 minutes. Correct me, Dr. Pitts, you're the physician, in order to contribute to heart health. Dr.
No,
Pitts?
you're correct. And not, yes, can you hear me okay?
Yes,
Yes.
Yes,
Okay.
Dr. Pitts.
Yes, you're correct. And keep in mind with exercising, it's not, it's not just the cardiovascular system that is benefited. Think of your mental health. When you're exercising, you are improving circulation to all parts of your body, especially to your brain. And with increased exercise, you kind of lessen the effects of things like mental health, like depression, because more circulation is
Yes.
going to your nervous system. And so you're right in that aspect. Everyone should do some type of exercise in the morning. And keep in mind, don't minimize the things that you do or that you might seem as not as important. Getting up, first of all, not lying in bed all day, but just being able to get up, walking to,
Yes.
let's say, another room,
Yes.
getting dressed, going to the bus stop, all of those things make a difference. And again, depending on your tolerance level, it depends for the person and their specific medical condition, but every little bit helps. And when I go to, I used to go to some of the senior citizens centers to speak with some of the seniors, I'd ask, well, who did some exercise this morning? And no one really raised their hands. But yet I said, well, you all are here. You all took some action to get to this center. You got up out of the bed, you got dressed. You at some point, I'm sure, went to the restroom. You got into some form of transportation. And so don't minimize those little things along the way. It's just making certain that you do them.
Dr. Pitts,
And you're
Dr.
right.
Pitts, one of the what you're talking about is what we term the sweet spot here in our partnership is the intersection between your physical health and your mental health. And so I'm really, really happy to hear this information that you're providing. I hope the audience really understands that this is top-notch information that we have access to, and really grateful for you bringing this to us. And especially in the days of COVID, people really need to also focus on, their physical health as well as their mental health and be active. And now we see that, even the information that you shared about the statistics for the general population, it even more adversely affects people that suffer from mental illness, including cardiovascular disease. So this is very helpful.
Yes,
Exactly right.
You're right.
Exactly
and again, it affects every part of us.
Mm-hmm.
And in living in community, you can't just isolate yourself and think that it'll be okay, that it'll go away. Whether it's having that chest pain, well, that chest pain is coming from someplace. And the point about just within the pandemic, having a chest pain, well, could it be due to anxiety? And again, the depression that we spoke about.
Sure.
People are suffering everywhere. And so whether, someone is, worried about losing their job, or they've already lost their job, they're still waiting for unemployment to come in.
So true.
Come in. So, the economic impact of what's going on certainly plays a role. And when people don't know how to manage, thinking that they can do it on their own, they're wrong, and they can't. Or at least it can work for a little while, but eventually it will advance to a point where by the time you do get to the ER, it can sometimes be too late. And this is beyond COVID. Okay, we're talking about your heart. So these are things to keep in mind as well. So moving on to the diagnostic test for coronary artery disease, and I'm just going to kind of go through this quickly. An ECG is sometimes used to diagnose coronary artery disease, and it just records the electrical signals that as they travel through your heart. your doctor may do an echocardiogram, which is just an ultrasound that outlines the heart's movement, an exercise stress test that, monitors your heart during physical activity. We know that when we're doing physical activity, your heart tends to pump more. And so looking at your heart's ability to pump, looking at like ejection fraction, things like that. I won't go into detail, but these are just some tools that are used that a cardiologist would use to diagnose coronary artery disease. A nuclear stress test. Now, that's a type of stress test where radioactive dye is used to show the blood flow to the heart. Also, cardiac catheterization and an angiogram. And those two things with a catheter, it's inserted into, let's say, the arm or the leg, and it's threaded to the heart arteries, all right? An angiogram, that's when contrast dye is used. It's injected through that catheter, okay? And as we go to the next slide, we have a visual of an angioplasty itself. And with angioplasty, the catheter is inserted into the artery, as you see in that top image. The second image shows where the balloon is inflated in that artery to widen it. Again, we're looking at the plaque along the walls of the artery, but once that balloon is in place, it opens up. And in the bottom image, the stent is in place, but yet you see in the middle part, the wire there, it's like a mesh wire. It remains. It remains because it is used to support the walls of the artery. Okay. Okay. Okay, so we have some technical difficulties. Brandy is asking if they send the link, the invite link back to Brandy because she lost power to her computer.
Oh, okay.
So
We need to have Randall. We need to have Randall to do that.
Okay. Right, and then she'll be able to pull the PowerPoint back up. And so, while they do that, again.
But what we can do in the meantime, what we can do in the meantime, what we could do really is to continue to keep, so we won't have a delay, just read from the slides.
That's fine.
That's right, yeah. And I know that the slides that are showing the X-rays and all, we can skip over those and just go right to the printed material and read those.
Okay, that's fine.
Like treatment,
Okay.
we can go to treatment.
So, okay, and all right. So yeah, so with the different types of treatment for coronary artery disease, there are different types of drugs that are used. And one is cholesterol lowering drugs. For example, statins, right? And statins will, as we mentioned earlier about, there are different types of cholesterol, HDL, which is the healthy or the good cholesterol, versus the LDLs. And so with statins will usually increase those levels of the HDL, thereby lowering the LDLs. Aspirin is used a lot of times to prevent, the actions of aspirin is it prevents platelets, okay, a component of your blood. It prevents platelets from sticking together, okay? And if those platelets aren't stuck together, then they can't cause a clot, all right? You want blood to flow freely through that artery, okay? And so sometimes a low dose aspirin, usually around 81 milligrams a day, is a treatment for many people, especially many older folks, and it's harmless. And again, it helps in preventing those clots. Beta blockers are a type of drugs that's used mainly for high blood pressure. The actions of beta blockers, it decreases the heart rate and the blood pressure. It causes your workload of the heart to lessen. So it's going to ease the workload of your heart. And if your heart is not overworked, then it'll be able to provide better blood flow. right?
Exactly.
And so an example of a beta blocker, they usually end in LOL. So think of like metoprolol or propranolol,
Right.
all right? Those you might have heard. And statin, an example of a statin drug is atorvastatin. Usually it has statin at the end of it, just to tell you kind of like the class of medication it is. Calcium channel blockers are also used. Now, calcium channel blockers, they prevent calcium from getting into the cells of the heart. When calcium gets into the cells of the heart, it usually causes the heart to contract more strongly.
That's
And
exactly
if you're
right.
already dealing with a heart muscle, the heart muscle that's kind of weakened, you don't want that heart to kind of be strong, you know, all right. Well, you want a strong heart muscle, but if you're already dealing with
You don't want it to
poor
contract.
heart muscle, it's not going to contract strongly, and you don't want it to. And so calcium blockers, these type drugs, they're going to prevent the heart from contracting strongly, all
Right.
right? Because when it does, it's going to cause further damage, all right? And so your doctor may prescribe a calcium channel blocker. An example of that would be a drug, let's say, called amlodipine, okay? Just as an example. Ranolazine is a drug that's used to treat angina, which is, you know, the chest pain. Also, nitroglycerin is a vasodilator, which treats angina as well. And as we mentioned before, angina is just, you know, used for really strong chest pain. Nitroglycerin is a vasodilator, so it's going to cause the vessel to open up, all right, and not
Yes.
constrict, but open up more.
Increases blood flow.
ACE inhibitors. Right, and so ACE inhibitors, ACE, it stands for angiotensin converting enzyme inhibitor. These are the type drugs that are used in coronary artery disease, but also for folks who have also diabetes usually. And with ACE inhibitors, they help the vessels to relax more, which is going to decrease your blood pressure. And an example of, let's say, an ACE inhibitor is a drug, let's say, like captopril. Those drugs usually end in pril, P-R-I-L, okay? ARBs, or what we call angiotensin receptor blockers, these are the types of drugs that expand the blood vessel, or, you know, cause a dilation of the blood pressure of the blood vessels. And again, when they're expanding, they cause blood pressure to decrease, which is what you want. Both the actions of ACE inhibitors and the angiotensin receptor blockers, they're going to prevent a substance in our blood called angiotensin 2. Not to get too much into it, but just to kind of understand what's happening. With angiotensin 2, it's going to cause vessels in the heart to constrict, okay? And so that substance causes vessels to constrict, meaning they're going to get smaller. When those vessels get smaller, blood pressure tends to increase. It's going to increase. And so what the actions of these two drugs, you want the total opposite. You want that the blood pressure to decrease. So the ACE inhibitors and the ARBs, they're going to prevent that from happening. They're going to prevent angiotensin 2 from getting into the cell, causing that increase in blood pressure. They're going to make the blood vessel increase instead of constricting and decreasing. Okay, so those are just some of the treatments that are used. An example of one of the ARBs are drugs like losartan.
And Dr. Pitts?
Those are the drugs that sure, yes.
I am so glad that you're taking the time to, as a lot of people know nothing about the drugs that the physicians prescribe. And it's so good that you're taking the time to just give them a little taste, knowledge of what those drugs do. If we can now go to your slide that says reducing things that you can do to reduce your risk. And then from that slide,
okay.
if we can go to your COVID one, which is, I think is apropos for what we're going through right now. So if you can go to the things that people can control, the things that they can do to reduce, and then go right from that slide quickly into the COVID, then this is so educational to the people. I'm just getting all hyped up because you're doing such an excellent job. So if you can go to the reducing.
Yes, sure. So there are a couple of things that we can do to reduce the risk of coronary artery disease. As we spoke about before, the modifiable risk factors, things that we can change. You know, we can't change our sex. We can't, well, some of us can, but at least regarding, as it relates to cardiovascular disease, there's some things we can do. So like lowering your blood pressure and your cholesterol levels. These come with a diet, as we spoke of earlier, a diet that is filled with, fresh fruits and vegetables. And some say, reducing your intake of red meat, lowering your blood pressure, taking your blood pressure medication. Number one, if you have hypertension or high blood pressure, and if you've been prescribed medication for that, you need to take it. So many people do not take their medications. They're out of compliance. And again, these are things that we can do. Eating a healthy diet, balanced diet, being more physically active, having a healthy weight, stop smoking, definitely. People don't realize smoking damages your vessels.
Right.
And so continue smoking, even, and there's a way to do that. Not everyone's able to just stop immediately, but over time, it does make a difference. And reducing your alcohol consumption. And again, you mentioned earlier, keeping your blood pressure under control. I included some information regarding COVID-19. I mean, within this pandemic, we have to stay relevant as to what's going on. And so keep in mind, this is still new regarding COVID-19, but research has shown that people with some of the following conditions, they are kind of in an increased risk of severe illness from this viral infection of the coronavirus. And so, number one, having cardiovascular disease, that is one of the risk factors. Having asthma, a person with a cerebrovascular disease, which is a disease that affects the blood vessels and the blood supply to the brain, like a stroke. Having high blood pressure, diabetes, people with immunocompromised states or weakened immune system, immunodeficiencies like HIV or those with high steroid use. And a point about the steroid use, we have to be careful with that, because with steroid use, steroids can in turn weaken your immune system. And
That's
so
right.
initially, early on, there were concerns about using steroids. I have a colleague in Europe, and they, at one point during the early part of the pandemic, were cautious as to not give some of their patients steroids because of that, especially those patients who were severely ill in the ICU. So we have to be careful about, always wanting to give a steroid for a condition. Neurological conditions like dementia. And again, smoking, those who are obese, 70% of Americans are overweight or obese. And those with certain lung conditions like pulmonary fibrosis, which is, when your lung tissue is damaged due to scarring. And just some things to prevent spreading COVID, as we've heard over and over: avoiding crowds, wearing your mask, avoiding close contact, staying home whenever possible, and frequently washing your hands. And so those are just few of the things heard of. Yes.
Let me tell you something. You have really done, and how do you say, excellent, par excellence. I think that's the French that they would say. But for this cardiovascular, I really like the fact that you took the time to go over the medication. That is the one area that a lot of people, I think, need to enlighten our viewing audience, because when you are prescribed a medication, I know they give you that sheet of paper, but it's really easy when someone like yourself takes the time and verbally explain what those medications do. So I really appreciate you taking the time and doing that. Excellent. You've got to come back on our program, Dr. Pitts. You've got to come back and do another topic. Reverend Clyde, she knocked it out the park, home run.
Yes, sir.
So you're gonna have to draft her. We're gonna have to draft out the pitch, draft her to come out and do some more.
Absolutely.
And I'd like to have you on my show, Focus on Health, TV show, Focus on Health, to do the same kind of a program. I like to thank, and let me do this as I always do. I like to thank New Horizons Behavioral Health for all that you do in the community. I like to thank Tree of Life for all that you do into the community. And I always tell our viewing audience, you have two organizations that I know here that do so much. If you can ever help them out, if you can contribute to them, if you can contribute even volunteer hours to help them continue taking care of y'all in the community. And so I always end the show with this one thing here. And with all the suicides and one thing that's going on in the community, I try to tell people, please be good and kind to yourself because God loves you.
Absolutely.
And we will see you next Monday. God bless you now. Bye-bye.
Thank you so much, everybody.
Thank you.
Thank you.
Excellent show. Are we still on?
Yes, yes, yes.
Yeah, they're gone.
No, it was fine. Did I answer your question?